Good afternoon, everyone. Welcome to Healthcare Innovation Summit Africa. My name is Fred Mumo, Head of ICT from AAR Hospital in Nairobi, Kenya. My apologies, I couldn't make it to the event, but I'd like to pass my gratitude to the event organizers, IT News Africa, for honoring me to be a key speaker in this year's summit. This is AAR Hospital based in the capital city of Nairobi, Kenya. For those who have visited Nairobi, it's a 140-bed hospital. It's a greenfield hospital in operation lasts 1.5 years. And it's going to be a big game changer in the healthcare industry in the country and the regions around. So I'll be looking at what are the challenges hospitals or challenges faced in healthcare. One is lack of interoperability between devices and information systems, lack of real-time data analytics capabilities, lack of patient-centered designs, which lead to patients not being engaged, hospital processes not being optimized. Then lastly, we have supply chain, which leads to poor inventory and asset management. We all know that ICT is an enabler to providing the best healthcare solution. And in this era of digital transformation, more decision makers and healthcare organizations are investing a lot of money in innovative healthcare technologies. My solution to these challenges faced in healthcare is very simple: smart hospital. A smart hospital is a patient-centric hospital based on highly automated and optimized environment that uses ICT to become more efficient and solve specific challenges. We are aware of the terminologies IoT, IoMT, Internet of Things, and Internet of Medical Things. This is solutions that healthcare industries or healthcare facilities, they have to align themselves with to be able to provide an optimized environment, a smart hospital. How does it look like? This is an ideal scenario of a smart hospital where the building, the equipment, the system being used, the infrastructure, ICT infrastructure are all automated to be able to provide the best experience to the clients and also to the healthcare administrators. In this image, you're able to see the innovation around it, around asset tracking, around enhanced patient safety by use of CCTVs. You can use RFID scanners to track inventory and asset movement, automated data generations, optimize patient flow through building hospitals designs which are designed for easy movement of patients. The first solution is providing unique customer experience. In this hospital, healthcare practitioners need to provide a patient-centric, reimagine the patient journey and provide the experience. How do they do this? By one, engaging and empowering patients. Patients need to be empowered, need to be informed through the journey and focus on their needs. What does the current patient want? The current patient want to be informed. They want transparency in the data that you're collecting from them. They need that data to be secured, protecting their information and their family members. The current patient or modern patient wants to be given safety, patient safety. And how do we ensure safety is given through feedback, monitoring their progress, and updating them continuously. Also, this patient requires to be trained and provided support. Patients want to be empowered by use of adequate tools that promote health literacy. We have all these terminologies, and every time doctors they are giving bad news to patients, they are giving diagnostic results without explaining or without breaking down into in the meaning of the diagnostic result of the conditions. Patients would like tools that can educate them, show them how, or train them how they can be able to take care of themselves without having to engage the doctors or the clinicians. And lastly, inclusive and affordable care. Modern patients would like to be engaged by providing a cost-effective and inclusive systems. Most of the hospitals, we are all aware that they have this, what is called hidden charges. When a patient is being admitted at the date of discharge, they are given or they're surprised by these huge bills that they are not able to understand how it came about. So in the providing patient experience, feedback is very key, and modern patients would like to be given periodic feedback. In my solution, I believe a real-time customer experience feedback system is very key to any hospital. Hospitals need to provide, they need to display their dashboards on average length of stay, average length of service, average waiting time, patient feedback details. As you can see in my illustration, I just given a graphical illustration on what hospitals can emulate and be able to provide feedback to their clients. Second solution, as I mentioned earlier, providing a smart hospital environment. This is the scenario I'm looking at. Looking at having or providing a patient that experience or unique experience where you're able to monitor every service, they monitor their movements. Yeah, modern hospitals should be able to track medication intake, should be able to monitor remotely the health condition of patients, should be able to track the drugs. And the tracking of the drugs or the medicine, they should be from delivery to bedside. We make procurement processes, or when we're purchasing these items, they are brought to the store, and nobody is keen to know what has come in, what has gone back. We have scenarios where these suppliers, they bring in drugs, and the time of offloading at the stores, they collude with hospital staff, and you're going to pay for what you don't have. Drugs are timed to be delivered, but they're taken back to the vehicles without anyone monitoring. So this solution around monitoring inventory and drugs will really help hospitals in managing inventory, as well as also equipment tracking. Modern hospital beds should be smart to be able to capture vital signs of a patient, looking at scenarios of an ICU patient who has minimal movement, and you find nurses always going back and forth to do the vital signs of the patient. This modern bed should be able to provide such solution. The other solution is hospital construction designs. We have been ignoring very critical and important personnel or professionals. These are the architects. In a modern hospital, I should be able to provide a conducive environment. We know hospitals are not always the best place to be. Patients feel like they're being, in a 10 by 10 or whichever size of the hospital bed or the room, they're being, kind of being in kind of a prison. I would say that. So hospital construction designs, they need to provide efficiency, cost effectiveness, flexibility, and expandability, the therapeutic environment, smart medical assets, accessibility, security, and sustainability. So when you're developing, when you're constructing hospitals, we need to engage all stakeholders and be able to provide the best hospital designs. Data analytics is another key solution. Without analyzing the data, hospital practitioners, they are always having been blinded by what the operations of the hospital. Hospital and data analytics can help in disease prediction and prevention, patient care coordination, financial risk management, and fraud detection. I see most CEOs and hospital administrators always asking for reports, and this should not be the case. They should be having this information real time, any time of the day, of the night, and of the year, so they'll be able to make prediction on when is the busy hours of the hospital, where do we need more staff to be able to serve patients better. And if you're able to do this, you find even staff are able to enjoy in this, working in this environment. Such data, like for instance, what I'm showing you is data from the Institute of Economic Affairs in Kenya, showing demographic data, population within the country, what is the average life expectancy, infant mortality, child mortality. Such data can be used by any healthcare facility to plan in terms of expansion, in terms of rolling out services in other areas. With this informed data, it will help that hospital practitioner to be able to plan ahead and be able to know which areas require attention, even for the government to be able to know which areas they require more input in terms of facilities, in terms of the qualified staff or the specialized staff. Thank you so much for listening. I'd like to thank you so much for this opportunity. Thank you again to the organizers. I really appreciate this, and you have yourself a good evening. Thank you.